Okay, so what I hope you can see is a document that says key terminologies. Is that right?
That's right. That's
Yep.
right, sir.
Okay. Yep. So what I'm going to do is navigate you around a mural board that I used actually in previous trainings when I've done the same workshop actually over multiple days. So you're getting the super slimmed down 30-minute version in this elite group. And I will move you around the mural board. And it's a training that I did in the Caribbean and also for countries in the Balkan region. So this, what I'm showing you here is the very basis of what a logical framework template would look like. So a kind of almost what many of you have in a standard project proposal, if you're using logical frameworks. And you can see on the left-hand side, there's three sections. You've got something called the goal, something called the outcomes, and something called the outputs. And these were terminologies that Ali went through from WHO in her presentation in the earlier section. And these are kind of the structure of the whole framework. The first important thing to know is that the goal is actually set in this framework. We agreed to have one single goal. And by goal, it's something that is very long-term in achievement. And it usually involves multiple programs or projects that feed into that. So a goal is not something that you would expect to have in a 6-month project or intervention in emergency. It's something that we work towards over multiple years. And multiple programs usually feed into it. So in the M&E framework, we have one set goal, which is reduced suffering and improved mental health and psychosocial well-being. And then in the, and that's what would come up in the goal line. Underneath that goal, we then have something called impact indicators. And in the framework document, if you bring it up, you will see on pages 20 to 22, there are a list of impact indicators, of which there are 6 for this particular framework. And I will go through them later on. And then with this new addition, we have the means of verification, which are related to the impact level. So the impact level is saying whether you have achieved your goal or not. And the means of verification is how you track or how you measure that you've achieved your goal. And you can find the means of verification in the pages that's written there. So pages 13 to 18 is the overview. But then in chapter 8, and importantly in Annex 8, is where you have the much detailed breakdown of every single tool that's been recommended. And the tools are both qualitative and they're both quantitative. So the next level down that we have in the framework is something called the outcome level. And in the framework, there's 5 outcomes that we've decided upon. And I will go through them with you as well. And they also have corresponding outcome indicators. As Ali mentioned, outcome 1, for example, has 9 indicators. Whereas outcome 4, that's looking much more at focused psychological care, has 4 or 5 indicators. So some have got more than others. And then the output level or activities is what some agencies refer to. That is not included in this framework. And we decided not to include it because they are so broad. The different types of activities that you can do in a mental health and psychosocial support program, either as standalone or if you're doing an integrated program. So the decision was made very early on in 2014, actually, to not go down to activity level because it just became unmanageable. And then crucially, what we have in the framework is also for every part of the goal and at the outcome level, it directly correlates to action sheets in the original IASC guidelines that were released in 2007. So if you are working on an outcome to do with mainstreaming psychosocial support and accessing human rights and safety and dignity, it will tell you where in the IASC guidelines which specific action sheets relate to the type of work that you're doing. So you can cross-check the quality of your work and to make sure that your programming and your approaches are in line with the core principles of the guidelines and what's recommended in the action sheets as well. So chapter 5 makes that direct link for you as well. So it's quite a handy way to check. And I'm just going to now navigate on the board, and I'm sorry if I make you feel sick. That's not the intention. But I'm just going to navigate on the board to the very famous pyramid. Okay. So I hope you can all see the pyramid now, the intervention pyramid. So as I said before, we have the goal, reduce suffering and improve mental health and psychosocial well-being. That's set. Then we have impact indicators, 6 of them related to the goal. And then we have 5 outcomes. And if you want to see the quick reference for the outcomes in the document, just look at the back page of the IASC framework, the new one that's been released, and you will find you will find the documents there and the outcomes listed there. So there's 5 of them. So some of them overlap the layers of the intervention pyramid. And at the bottom, you will see that we have 2 outcomes in the framework that relate to the social considerations and basic services and security. And this is outcome 1 and outcome 2. So outcome 1 is this outcome in pink down here at the bottom right, and it's emergency responses, do not cause harm, dignified, participatory, community-owned, and socially and culturally appropriate. So very much focused on mainstreaming and advocating for a psychosocial approach in activities usually conducted by other sectors. So the water, sanitation, hygiene sector, or food security, or camp management, for example. And then outcome 2, which is the one in blue, on the right side on the bottom layer, is looking very much from a protection lens and is focused on safety, protection, and human rights violations, and to ensure that they are being addressed. So we are not doing harm by inappropriately distributing food, for example, or by doing an inappropriate cash distribution. So those 2 outcomes are at the bottom layer pyramid. The third one is the yellow one, which a lot of agencies tend to report against. It's probably the most commonly used outcome because it covers a lot of the group activities, family type interventions, recreational activities, child-friendly spaces, those types of things. And this is looking at family, community, and social structures promote the well-being and development of all their members. So that's a very popular outcome, and that's outcome 3. And then we have outcome 4, which is the turquoisey color, looking more at layer 3 in the intervention pyramid. So we're beginning to come down to more individual, focused type psychological work. And here we have communities and families support people with mental health and psychosocial problems. And that's quite critical one, also covering issues to do with stigma and discrimination come under there, because we're looking at not the person that's being diagnosed or the person with a mental health condition. We're looking at whether their family and community are supporting that person, so whether they're not being discriminated against, as well as things like parenting groups. If you have parents with a child, for example, that's got a developmental delay. And then at the top level, we have the one in pink, which is looking very much more at focus care, including clinical services as well. So that one tends to be covered by organizations doing specialized services and clinical type work as well. So that's the 5 outcomes and how they map out on the pyramid structure. So if you don't have time and you have to quickly design a log frame and you need to do the M&E around it, just think about which outcome relates to your type of project, and then you can kind of zoom in on that area of the intervention pyramid and find out the corresponding outcome. And it just is a quicker way of building a log frame if you have to do it quite quickly, which most of us do, to be honest, as well, when writing projects in emergency settings. So that's how the outcomes fit. Now, in the document, in the actual framework document, you will be able to see on pages, well, on the back page you have the goal and you have the 5 outcomes, and then you also have tables that break down all the indicators as well. And I'm just going to show you some of those indicators now, actually. Oh, just bear with me. Sorry, it's very slow moving around the board this way. I don't intend to make you sick, so I'm sorry about doing this. Okay. Okay. Okay, so what you can see here are the ones in blue. The ones in blue here are the key impact indicators. And as you see, there's 6 of them that are written down. So broadly speaking, the first one is looking at functioning. The second one is looking at subjective well-being. The third one is looking at prolonged or disabling distress. Okay, so looking very much at symptomology. The fourth one is looking at coping. The fifth one is looking at social behavior. It can be negative aggression, for example, or it can also be pro-social behavior in terms of inclusion activities rather than discriminatory activities. And indicator 6 for the impact is looking at social connectedness as well. And you can see here in green on the right, we've also got the 5 outcomes written again for ease of reference for you. And all of these, as I said, are included in the framework under the pages I mentioned before. So what I'm going to jump to now is actually the tables for the monitoring the means of verification part of the framework. Okay. So you will see this document in the framework when you have a chance to have a look at it in more detail. And this is just a graphic representation of the quantitative means of verification. Okay. I'm just going to put it in the center so you can see a bit better. Okay. So what you can see on the screen here is you've got the age ranges down the left-hand side, 0 to 5, 6 to 11, 12 to 17, and then you've got adults. We did initially want to break down the means of verification for the adults, but we found that when we were going through all of the different tools available, very few separated out older adults, for example, so 60 years and above, or even said that this is very good for a 25-year-old, but is not so good for a 50-year-old. That nuance did not come through in the tools that we reviewed. So we ended up lumping together basically adults, so anybody 18 years and above. And we flagged that for future research, being able to differentiate, certainly for older adults because they have particular mental health needs, it's critically important. At the moment, we don't have particularly good tools for humanitarian settings for older adults versus, for example, working with teenagers or adolescents where there is more granular detail. So what you can see here is that what we did with the means of verification tool, remember these relate to the 6 areas of impact that you can measure. So you can see on the column that says functioning here, there are particular tools that you can use if you wish to use functioning. Sorry, I'm being asked to zoom out a bit. Is that better? Whoever asked me to zoom out a bit.
If you can zoom in a bit.
You want me to zoom in or zoom out?
Zoom in, Sarah.
Zoom in.
Yeah.
Okay. The other thing you can do is if you can't see it so clearly on my screen, if you have access to mhpss.net, their M&E toolkit, you can click on the functioning button on their screen. It will bring up the functioning tools, for example. Okay, hopefully you can see it now. So under functioning, we have different options for different age ranges. So for the 0 to 5, we have recommended those 3 tools. And so for 6 to 11, those tools recommended, and also for adults. And we've done that for all of the 6 areas that you can use to help measure impact, which, remember, is the goal: reduce suffering and improve mental health and psychosocial well-being. And what you're going to do then is you would write your goal, you would then select which type of impact you want to measure based upon your project or your program. So are you wanting to look at functioning? Are you wanting to look at distress? Are you wanting to measure coping, for example? And then based on that, you can then go to this table and you can find the quantitative, so the tools looking at numbers and scales to help you measure your impact in your project. So I will just scroll across now so you can see the different areas. So we have done it for all of them. So we have the subjective well-being, we have the disabling distress symptoms. There's a lot here, particularly for adults, partly because it's easier using a quantitative tool in a clinical setting for organizations doing more clinical mental health services. But we have also done it for coping, for social behavior, and for social connectedness as well. So you basically have a ready-made tool that you can use, and most of them, well, the criteria for inclusion was that they had to have been used in 3 or more humanitarian settings, and with documented evidence in terms of peer-reviewed journal papers. There were some other inclusion criteria in terms of availability in multiple languages as well that were key factors. But this table is just the quantitative table. Okay, so it's just looking at your numbers and your scales. And what we encourage, and we actually kind of really strongly recommend, is that you also have qualitative measures and means of verification in your tools. So what we also have is in the framework, and I'm sorry if I'm making anybody sick, is the qualitative tools. This table's a little bit complicated. And it's got a slightly different color scheme actually now in the M&E framework, but this is the one I had last year to work with. So what you will see on this mural board here is on the right-hand side, you will see that we've grouped things together. So we've got different types of means of verification for qualitative work, okay? And by qualitative work, we're talking about mapping, and we've got a whole example of methods here. Got examples of focus group discussions, how to do them in green, interviews, different types of interviews, most significant change approaches, ethnographic interviews, free listing, using cards in interviews. We also have observation and documentation approaches, and then more creative data generating activities or methods that tend to involve things like diaries or photojournals, storytelling, videos, children or adults doing videos, for example. So the colors from this table correspond to the colors in this next table I'm going to show you, which are the qualitative tools. So in exactly the same way that we had for the quantitative one, you can also see on this qualitative one that we have broken it down with the same age ranges here on the left-hand side. And then we have the same 6 impact indicators at the top. And then you need to pick your means of verification in relation to that particular impact that you want to measure. And then these will tell you the different techniques or approaches that you can use. So in Annex 8 of the framework, it tells you for the particular tool, like the particular quantitative tool that you might want to use, for example, the Oslo 3 tool on coping, or on social connectedness, sorry. When you go to Annex 8, it gives you the breakdown of that tool, where you can find it, the direct link to that tool, where you can find it, where it's been used, and you can then usually download it, or you can access the scale directly. For the qualitative ones, there's a section in Annex 8 where it breaks down and goes through all the different qualitative approaches that we recommend using, which are the ones written in the previous table I just showed you on the right. And then it will tell you how to do a focus group discussion using prompts or cards, or how to use the most significant change approach in your work. So these tables here are also in the M&E framework. If you look at pages 13 to 16, this is where you will find most of the tables. And this is like your navigation, actually your navigation tool around the whole means of verification one. So this is in the PDF document. But because we have geniuses and wizards at mhpss.net, they've actually created this version, but in an online toolkit. So you can actually just click on coping in the toolkit, and it will bring up everything to do with coping, to do with qualitative tools and quantitative tools, to make it even easier to navigate. And it's particularly good if you've got a great internet connection, you can do that. But also for the colleagues based in areas where you don't have great internet, the PDF version also has these tables to help you navigate as well. So what I'm going to try and do now in about 5 minutes, which is frankly ridiculous, but I'll do it anyway, is to go through a project as to how you can build a logical framework basically based upon what's written in the toolkit as
Sarah,
well.
if you want another 5 minutes, you can take it.
Look at that generosity. Okay, so 10 minutes.
Truncate the process. Yes.
Thank you. So what usually takes an afternoon in a workshop, we're doing in 10 minutes with you. Okay. Okay. So what I can do is on this mural board, there is a very cute case study that's from the Balkan countries that I hope you can read it now. Can you see it on the screen? Yeah. Okay. So I'm going to give you about 30 seconds to read it in peace when I'm not talking. So I'll let you read it now. Okay, so that's the case study. Broadly speaking, we're talking about a hotline or a telephone service provided to older adults aged 60 years and above who are in quarantine, and it's created in relation to the COVID-19 pandemic. And this is taken from the Balkan region. And the objectives of the whole program, we're looking at self-esteem, creating self-esteem, self-confidence, enhancing social interaction in the community, and also looking at coping as well, and people coping with their stress and trying to manage the difficult situation with the pandemic. So the first thing that we need to look at is, I'm just going to zoom out a bit. The first thing that we need to do is look at our goal and say that the goal is set. As I said, the goal statement is set. So it's reduce suffering and improve mental health and psychosocial well-being. And what we need to do is contextualize it. So we can say that we're looking at reduce suffering and improve mental health and psychosocial well-being for 100 adults, let's say. Okay. So that goal is then set. And what we need to pick next is a relevant impact indicator in relation to the case study that I've shown. And for ease of time and to minimize the discussion, because we have 8 minutes for this section, I'm going to say that I will pick the one that's to do with coping, so helping adults cope with their problems. So helping them with the skills in communication, with stress management, with problem solving in relation to their problems that they have. So this is impact indicator 4. Okay, so we can put this one down as the impact indicator. And that, as I said, it's got cope. So it's the impact indicator we're looking at is coping. And then we need to go back down to our tables down here, and we need to look at coping, okay, which is this central line here. And again, we need to look at the adult population. And then from that, we can pick which scale we think is most appropriate. So whether we want to use a brief cope, the brief resilience scale, or the adult hope scale. So you would then go into the toolkit, you would look at those 3 scales and say, okay, which one of these would make the most sense for this program? Which one of these can we train our staff on, which one of these is contextually appropriate for this particular region or this population we're working with. So the toolkit will help you find it. And then you can select the one that you think is relevant, or you might say none of these are relevant. We might need to develop something our own. So that's what you can do for the quantitative. And then you need to do exactly the same thing for the qualitative. So we need to go to this qualitative table. Again, sorry for making you sick. And we need to look at coping. Okay. And we need to look at the older adults age group. So it's this bottom section here, and you've got lots of options. You can do most significant change approach. You could use diary entries or journals with the older adults writing down what they had done in each telephone session. You could also have more classic focus group discussions with them. So again, you would then pick which one of these qualitative approaches you would like to use in relation to coping to measure your impact indicator. Okay. We're now going to go back up and we're going to have a look. Sorry. At the outcome one. Okay. So you can see here we've got the 5 outcomes, which are also written on the back of the framework document. And out of these, we can pick which outcome we think is most relevant for this particular type of project that we're doing in the Balkan countries, in the same way that we picked a key impact indicator. So the one that I suggest that we can take here is we can say communities and families support people with mental health and psychosocial problems. So then we would drag this one, you would put it across in the table here. And you will see that we're looking at outcome number 4. You can also have 2 outcomes, that's also possible. So we can also drag across outcome 3 as well, for example. Okay, and then what we'd need to do is to go back to our framework, and you would need to look at the chapters where you have outcome 4 and the chapter where you have outcome 3, and it will then give you the breakdown list of which outcome indicators are most relevant for that particular outcome as well. So I'm going to see if I can find it very quickly on the M&E framework for you before they kick us out and send us back to the main room again. So let's see if I can now share this screen. Share. Screen 1. Okay, hopefully you can now see this is a list of the outcome 3 indicators from the M&E framework on page 29. So from this, you would then pick which outcome you think is most relevant for the particular project to do with the older adults and the telephone support provided to them as well. And then you can do the same thing for outcome 4. You would then select which indicator is most relevant for outcome 4 as well. So the page for outcome 4 comes afterwards. And here you've got outcome 4 indicators. There's only 4 of them actually for outcome 4 as well. And then you would take that indicator and you would put it in your log frame. You'd have to adapt it to make it specific to the project and the population, but the wording is there to work with. So what is not included in the framework is the means of verification for outcome level. Okay, so that you would need to work out yourself with your respective organizations. We only have means of verification for the 6 impact level indicators that are there. Okay, I'm going to stop sharing my screen now so I can actually see who I'm talking to as well. And also, because they haven't kicked us back yet, I think we might even have time for questions. as well. And I might even have time to answer them as well. So if anybody has a question, I hope you can unmute yourselves. Aloka, can they unmute themselves?
Not unmute, but I can unmute. If you have any questions, just raise your hand. I can unmute. We have 3 more minutes, Sarah.
Oh, there we are then. So does anybody have any questions?
On the chat, we have some questions.
Yeah, I'm just reading your question, Alberto. Thank you for sending it. Yeah, so I hear what you're saying is that with the challenges that you have is that the responders there are being asked to do a lot of data collection for means of verification, and it takes a lot of time for them to do, and also the complexity of it. For any of the means of verification approaches, whether they are qualitative or whether they are quantitative, there is an aspect of training that's required. And that's the case for all of it. And it is a technical area. It is a big area in its own right, means of monitoring evaluation, sorry. So whatever you can simplify, but still make it meaningful, both to the populations you're assisting, are we meaningfully measure what we promised that we were going to do with this population? But it also needs to be as simple as possible for the staffing and the volunteer capacity that you have. But as I said before, for all of them, you're going to have to do some training for enumerators or data collectors or the facilitators. But that can also be budgeted. You can put that in project proposals. So the capacity building and the mentoring and supervision of staff also includes capacity building and monitoring and evaluation. It's not just about capacity building in a particular psychosocial activity. So it's possible to budget for it and to ask donors to support this as well. Focus group discussions are always cumbersome. Any qualitative one takes more time in terms of typing up what notes you have. Yeah, so your transcription takes time, note taking in a focus group discussion, and then transferring that into something that you can put in a project proposal or project report does take time. It is a little bit quicker using clinical scale, certainly in clinical settings. And doing it on a national level is enormously challenging. You have multiple focus group discussions, and there's just a coordination aspect to do as well. But none of this is specific to mental health and psychosocial support. Those issues are the case whether you're also doing a food program or a water and sanitation program, if you're also doing feedbacks with service users of water as well. So my advice is put it in project proposals and budget for it as much as possible, so that you can do the trainings and so that you have the time and the transport and logistics to do data collection as well. And Pred, yes, if you have money, get an M&E person because they're very useful as well. Okay. That's it, folks. You are an elite group. You literally had 30 minutes for an entire framework that we usually do over multiple days. So thank you for joining for this session. And if I know it was very quick, and I'm sorry if I made you sick, but you get the option to watch this video all over again because it will be made available on the YouTube channel for mhpss.net as well. So please also share it with your colleagues if they weren't able to join today.